Hello. So, the field of healthcare has been pretty fascinating. All the things that we have learned this semester and all the trends in regards to technology and also regulations and also careers has been phenomenal to see, actually, to even learn about. My name is Mary Beverly, and I am presenting on behalf of my group, group number two, which does include Debbie, Karen, and also Abiyami. We will focus on the trends that we see taking place in the world of healthcare, and then we will look forward to actually looking ahead at the careers that will drive the future of healthcare. So I will begin with economy, and economy really having a huge impact when it comes to cost. Cost will continue to rise as healthcare costs have been rising for years. And in the near future, it will continue to rise due to the decisions in government maybe to repeal and replace the Affordable Care Act. Those decisions are still being debated. Just depending, though, will have an effect on the economy because that is going to be whether millions will remain insured or where millions will become uninsured. And either way, that will have an impact to cost. It will have an impact to the economy, our jobs as healthcare administrators, how we will have to perform, what we will be responsible for. So economy is kind of still waiting to see what's going to take place, what's going to happen. Next, we look at the personal lifestyles and behaviors. And in our presentation, we focused on healthier lifestyles that we as a nation are pushing towards, that we actually need so that we can maintain rising costs and the national debt with health expenditures just being at the high rates that they are. So with the focus on personal behaviors is if we look to be a healthier nation, we can drive down cost. Being a healthier nation is focusing on preventative healthcare services where we're just able to live and do and perform in a healthier lifestyle. We're kind of seeing that take place as we see more people purchasing GPS watches such as the Garmins and the Apples and the Fitbits, and they're using their phones to download apps to actually, keep up with their movement and what's happening. For example, many will let you know, they'll let you log activities, they'll let you know if you've been sitting too long, you can breathe with it and it will give you your heart rate. These things are allowing us to be healthier people. They're assisting us in moving more. They're assisting us in our daily activities to have a more active lifestyle. Next, we'll look at demographics. And demographics basically is the baby boomers. That's what we focused on in our presentation. Baby boomers, they are going to make up the most of the population moving ahead. And what this means is the baby boomers, they are going to require more services. So health aides are going to be a very, very important piece of the healthcare administration role. Administrators will look to be able to care for baby boomers, and elderly people will require more services and they will require more in regards to costs because they're not healthy, but they're living longer, and for that reason it's going to play a huge role in the healthcare field on how we take care of them. whether they're in the hospital or whether they choose to be at home. They will need help in their medications. They will need help in just their daily activities. So we'll look more into that as the roles that will be needs to fill for assisting and helping baby boomers. Next is the technology, and technology again has allowed the world of healthcare to transform in a way that is beyond. It's gotten to the point where as soon as one idea is in place, a new one is coming. And that's just the world of technology. It's moving so much faster. It's allowing collaboration and communication to be different. It's demanding collaboration to be different. The way that we communicate with our doctors, the way that we access our information, the way that we are informed in our health care. We are requesting more innovative approaches to how we get that information or even how we're treated. Technology now allows us to have virtual visits. Technology now allows us to not have to step into a doctor's office where, again, we'll be able to save costs, but it offers a more convenient way to receive service, medical care. It also allows a more cost-effective way to receive health services, and it offers a more convenient way. We live differently now. We communicate differently now. We demand our information differently, and technology is allowing us to do that. For example, through electronic records, through electronic health records. We're now able to share information, medical records, medical history, medical information to doctors, which is going to offer and give us a more streamlined approach to receiving health care. Again, minimizing cost. Finally, we'll look at federal government. And what federal government has done is really to ensure that indeed, with this fast pace of technology, how we're able to access information, that indeed it is secured, that it remains private, that it remains confidential. And so when we look at government policies, the HIPAA regulations, we're discussing and showing the importance of theft, not allowing theft to take our information. So there's theft and abuse, fraud, all of that we have to look to, that hackers are now trying to access our information in all kind of different creative ways to sell. And what we want to know as members is that indeed, when we go see our physician, whether it be in the hospital, whether it be at the primary care office, or whether it be a virtual visit, that indeed our information is still private. Because if we are not in compliance, if hospitals and doctors' insurances are not in compliance with the HIPAA regulations and the mandates that government has put in place to ensure that our information remains secure, it will cause a disaster. Health information will be impacted, and we won't feel trusted. It won't be trusted information. We won't trust our health system. And on a personal level, for any individual that has their information compromised, it will create ripple effects in everything in everyday living. So we want to avoid that. So we look at those things in what HIPAA and the importance of keeping information secure. Lastly, we discuss careers, the exciting career opportunities that are ahead in healthcare. And that is anywhere from nurse practitioners to biomedical engineers to IT specialists to home health aides and also physical therapists. What we look at is the biomedical engineers, how, again, we're back to technology, just even in the career aspect, where 3D printing has become something of this generation in the world of technology. We're now able to, it allows for a faster recovery, but we're able to access limbs. We're able to, there's just innovation within the biomedical engineering that has created a type of, yeah. So that is an overview of our project, what we have presented, and what we can look for. And what's really, really exciting is that we should embrace healthcare, the technology, the changes that are on the horizon, that are happening. We want to embrace those because it's going to make for phenomenal opportunities for things to be able to take place and just offer better care for patients. And that's what we want to do. We want to be able to stand on our care and empathy towards people and ensuring that they receive the greatest health care that is available to them. Thank you very much for your time. This has been wonderful, and we are excited for the years to come. Thank you.